guys, I am a nurse student at HSON, and today we are going to mention aseptic technique throughout all the procedure. So what is aseptic technique? Why is it applied and how is it applied? So what is it? Aseptic technique is collection of medical practices that is done to prevent infection for the wound. Bacteria and microorganisms are found everywhere. So aseptic technique will help the wound to be protected from these microorganisms and to prevent the equipment to be contaminated. So why is it applied? So aseptic technique is applied to protect the patients from healthcare acquired infections and healthcare providers from body fluids and microorganisms that can be taken from the patient itself as well. So how does the procedure take place? Let's see.
Good morning guys, my name is Untitled Chapter. I'm a nursing student from HSON. Today I'll be demonstrating some aseptic techniques. So first things first, before doing any procedure on the patient, you have to make sure that you have to identify yourself and what you're here to do. So after that, we need to identify the patient. So we ask for the triple name, we ask for the date of birth, and as well we have to check their identity band and their case number to make sure that we don't miss anything. Before proceeding with the procedure, we have to make sure that the patient consents to it and the time it's going to take. And ask the patient if they have any pain going on, if they require any pain medication. And then once we get everything cleared out, we'll go ahead, close the privacy curtain or the door, and then we'll proceed with the procedure. Before beginning with our aseptic procedure, we need to make sure that we have all our tools laid out. So first things first, we need to have a table that will come up to our waist level. So before beginning with our wound change, we need to make sure that our table is clean. So after cleaning our table, we need to make sure to perform hand hygiene, covering all areas of our hand.
Okay, Abdullah is now going to open the prep set in a sterile way. So we usually start with the folds. We start with the open fold, with the upper one extended to the end. The right, the left, the right. Yes. Okay, on to the back. So we have our sterile field now. So in the prep set, we have the forceps, the tweezers, and the scissors. We also see gauze 4x4 and larger ones, as well as a blue pad underneath.
So after opening our prep kit in a sterile way, we need to start decluttering our equipment. So we do this by keeping in mind the concept that sterile touches sterile, non-sterile touches non-sterile.
That's wonderful, Abdullah. I love this technique that you're using.
So another thing to mention with sterile techniques that you need to make sure to never turn your back towards the sterile field and never put your hands under your waist, as that is considered contaminated, as mentioned before. So we need to...
Abdullah, I want to add as well that all the borders of the sterile field, around 1 inch of the borders, the parameters, is considered non-sterile.
Yes.
And I love the fact that you're using this technique, special techniques to, as you said, declutter the equipment.
Hi guys, my name is Linda and I'm a student here at HSON. Today I'm going to be talking to you guys about the different types of wounds that you might see upon assessing them. So first of all, we have two types of wounds. Wounds can either be intentional or unintentional. Intentional wounds are for therapeutic reasons usually, such as a wound made during a surgery to reach a certain organ. And unintentional wounds can be like trauma or hitting or cutting yourself while doing something. Now, these wounds can be of two types also. They can either be open wounds or closed wounds. Open wounds are when the skin or the mucous membranes are actually open and exposed to the environment, and that can happen after a cut or an incision using a sharp object. The closed wound is when the organs or the tissue underneath the skin are injured, but the skin itself is still intact, such as a bruise when you hit your arm against the wall or something. These wounds themselves can be either acute or chronic in their healing process. So acute wounds are wounds that heal within an expected time, such as an episiotomy after 9 to 10 days. And then we have the chronic wounds which don't heal in the expected time. They take a very long period of time due to inadequate circulation of the blood.
Hello, my name is Isra. I'm a nursing student. Getting on Ramadan Baladat and after all the material is ready to proceed, I'm gonna do the wound dressing change using aseptic techniques. Okay, so I wear on my gloves and now it's time to change the dressing. I'll be exposing the area, but at the same time maintaining patient's privacy. I remove the soiled ones, assessing for any drainage, the color, the odor, and make sure that I'm pulling it with the growth of the hair, not to hurt the patient. If the patient is hairy, I can use a little bit of saline to remove it without hurting him.
Now we want to assess the wound. We use the abbreviation RIDA upon inspection. So R stands for redness. We check for any redness around the wound. E stands for ecchymosis, which is any bruising around the wound. The other E stands for edema, if there's any buildup of fluid around the wound. We have D, which stands for discharge, if there's any substance or liquid coming out of the wound. And then A stands for approximation, which is basically the edges of the wound if they are closing the way they're supposed to.
Okay, so now I want to assess the edges, the color, the odor, the edges if they are closing, the sutures, and the interaction of the patient if he's feeling any pain while I'm changing the dressing. It's time to remove my soiled gloves and wear sterile gloves instead. Okay, so I wear the sterile gloves and I have to maintain sterility, changing the dressing.
Bringing the four angles together and then having a good grab with the tweezers or the forceps. Making sure that the gauze is well sucked by saline, normal saline, sterile normal saline. And the wound is cleaned from up to down, ensuring that all soiled material is removed.
So upon every stroke, I have to change the gauze to maintain sterility. From the top to the bottom. And if the wound is open, from the center to the edges. Now I'm drying the wound. Now I'm applying a new dressing to the wound. So after finishing the wound dressing, we have to document all the findings.
Doctor's role. So doctor's role might be changing the dressing of the wound that is critical and extensive that need irrigation. And the nurse's role actually will be here to assist the physician to check the integrity of the equipment and the sterility maintenance throughout the procedure. So in aseptic techniques, we have two types, touch and no touch. So touch is a direct contact between the sterile glove and the wound. And no touch is the contact with the wound, however, using forceps and equipment. So when touch is used when the physician needs to address the wound deeply in the body, and it's actually used as the last step to maintain the stability of the gloves.
Get well soon, and thank you for listening and watching.